My name is Dr. Albert Gomez, and I'd like to welcome all of you to this taping of the Pueblo Healthcare Forum number 4. We look forward to hearing from persons who are making important contributions not only to our knowledge in healthcare, but also in our ability to diagnose and treat patients. We're going to be first hearing from Mayra Nava, who is the Executive Director of Pueblo Health and Educational Programs. She's been the director for the past year and has been making tremendous amount of contributions to patients who otherwise would not be able to afford their health care, let alone some of the other needs that they have, including assisting with their families when they most need it, when they have someone who is very ill and causing other problems within their family structure. There are 4 important functions that we try to accomplish every year. The first one is that we try to be a clearinghouse of information that's available to not only patients but also doctors and agencies about what's available out there to help people. One of the biggest problems that I ran into when I was trying to help my own patients was what is the agency or the address or phone number that I can give a patient to help them get services that are available. And so this is one of the prime functions that we have is giving agencies the ability to bring their information to one center so that we can distribute it, and also giving the patients and doctors the center to obtain their information. The other function that we do is we hold these forums. We try to hold them every quarter. We call them the Pueblo Healthcare Forum series. And the purpose of these forums is to bring people from different disciplines in healthcare, bring just members of the general public, invite government representatives, invite insurance representatives, invite people who have some concepts about how healthcare should be changed or improved. So these forums are very important to us because it allows us to bring together different ideas so that we can share them and also make new contacts, so for the future we can have the ability to build upon what we learn. The third function that we do at Pueblo Health and Educational Programs is we do have fundraisers, and this takes the form of a Baystars annual gala that we usually have aboard the USS Hornet aircraft carrier. This year we decided not to have it because of the uncertainties of the war and the problems that possibly would continue throughout the summer. So we decided that we would postpone that and then plan for a major event in August of 2004 aboard the USS Hornet. So we want to alert you to that. The other issues that we have is we try to have a program to raise money around Christmas time, and so that will be announced as far as the actual date probably by the end of the summer here. So we hope to see all of you there. We will try to have events for fundraising and also for forums in San Diego and Los Angeles areas. We, in the future, will have programs in other states, including Arizona and Texas. The fourth function at Pueblo is that we try to actually raise money to make some payments to providers for services that patients may not be able to afford. So we will pick certain tests or treatments that we can arrange to have patients obtain, but also we will assist in the payment of those services directly with what monies we can raise. The final view of healthcare from the point of view of a nonprofit has to do with the cooperation of all the agencies. Most of the work that we do at Pueblo really doesn't involve much money. I think that Mayra has proven that when she tries to help persons, all we have to do is ask. We ask physicians, we ask laboratories, we ask pharmaceutical companies, and really we have never had difficulty in obtaining the help we need for patients that really can't go anywhere else. So I wanted to impress upon you the fact that because of the ability to contact persons in a common forum, the nonprofit organization that we've created is able to deliver many, many more times the value in terms of dollars of health care compared to just straight out purchasing or donations. Saving money, saving lives. And I actually got this title from a new book that was written by former Congressman Newt Gingrich. His book is called Saving Money and Saving Lives. He basically stated that, in his opinion, that healthcare really needed to have the same effort as a war on terrorism in terms of government focus. And they have what they call a war room for healthcare in Washington, D.C., which I hope to visit one day. I have no idea what they have in there, but supposedly they're really working on trying to pull together concepts and people to discuss what it's going to take to bring the level of healthcare services up to the par. The work that was done by Newt Gingrich, he says he interviewed thousands and thousands of people, and they came up with the old and what the new should be. I wanted to just go through them with you as far as how they break them down briefly. We're provider-centered in our healthcare system now. I'm not sure that I disagree that that's a problem or agree that it's a problem, but we have to look at what they mean in terms of provider. I mean, it has to do with the doctor-patient relationship. There seems to be a lot of interest and focus on having the healthcare system being individual-centered, and we think that those are the new ideas that people are looking at in terms of fixing the healthcare system. One is that in the 20th century, healthcare is price-driven instead of looking at really what are we getting value-wise for what we're purchasing. In other words, quality and value versus worrying about the price. And knowledge disconnect means that we really don't have the communication among physicians, technology, and those people who are paying for the health care. And the consumer really wasn't informed, but now with the advent of the internet and direct advertising by pharmaceutical companies and the involvement of the public in their own health care, we're now getting a knowledge-intense healthcare system. There's a slow diffusion of information in the past. The concept was that doctors and government and the healthcare industry participants really don't take on the advances in knowledge and technology as fast as they should. There's the opposite, in which we should have a rapid innovation and incorporation of new knowledge and technology. The reactive and disjointed line reversed to really that we're used to taking care of people when they're sick and really don't worry about prevention or early diagnosis. And that should be something that should be for the future in terms of prevention of disease and coaching. The paper-based medical records versus obviously the electronic and computer-based, internet-based. The issue of third-party paying for health care needs to be looked at in terms of one of the big problems for change. The limited choice idea versus increased choice, and that has to do with, again, who's paying for the care all of a sudden is making the choices for you. Outcomes in terms of what treatments really are useful and helpful to patients. Do we really know if a treatment is cost effective or not? The suggestion is that maybe we should look at outcomes and focus in on sorting out, putting time and effort into deciding what's best and value for the dollar. The big issue, I think, that has not been emphasized enough is that before we were used to accepting the fact that healthcare, there's an overall cost increase, and in reality, I believe that this is the most important issue which will help us address all the above, and that's that there's really been an overall cost decrease. And this is due to advances in medical science and also advances in medical technology. So these are the assumptions. I wanted to present these to you as topics that have been summarized for the purposes of addressing the problems of access to health care and cost.